Hi doctors, Focus 30 fourth day. Today I am going to discuss very important but small topics. Okay. So what are the topics contents I am going to discuss today? It's related to autopsy. Sure, short question from forensic medicine, autopsy. And 2 years back, 2024, there was 2 to 3 questions. And it was very important and confusing. Whoever did correct, they got good rank. So I was very good at that and I corrected all the questions. Okay. And dactylography, very simple. And semen and blood stain, this is also very important topic from forensic medicine. IPC sections and some radiology spotters and images. Okay, now we are going to the main topics. So see, we know types of autopsy incisions. We have, you can see I shaped incision, Y shaped incision, see Y shaped incision, modified Y shaped incisions. These are very important. Okay, and we have X shaped incision and inverted Y-shaped incisions. So I-shaped incision, Y-shaped, modified Y-shaped, inverted Y-shaped, and X-shaped. These are very important. So you know from where it starts, where is ending, it is important. So you should know what are these incisions, and especially like Y-shaped incision indication commonly done in females for cosmetic purposes. That is Y-shaped. Modified Y. So this is also is that there is the incision is little above. An inverted Y-shaped incision, so performed in newborn or infants. In newborn or infants, inverted Y incision is done in autopsy for newborn or infants. Okay, and X-shaped incision, so used in case of suspected custodial death. Any suspected custodial death, X-shaped incision is done. So this may be a potential question for your next NEET PG exam. So I-shaped Y, modified Y, inverted Y, which is seen in infants or newborns, and X-shaped, okay, custodial death. Okay, very important. Now we are coming to different methods of autopsy. This is the area where question will come, and already question came. So now we are going to see different methods. One is Virchow method, Letule's method, Gon's method, and Rokitansky method. 4 methods. So what you can see in Virchow method, here organs are removed one by one. So organs are removed one by one, and most commonly used method is a Virchow method. So question is most commonly method is Virchow, organs are removed one by one. Question. And Letule is should known as en masse. Letule is known as en masse, because here as a mass it is removing. Cervical, thoracic, abdominal and pelvic organs are removed as a large combined block. It's like block. Cervical block, thoracic block, like the pelvic block, it is taken as in block. Okay, so it is like en masse, as a mass it is removing. Okay, so this is allow rapid removal while preserving key anatomic relationship. So whenever we are removing as a block, anatomical relationship is preserved. Okay, clear. And next one is our Gon's method. This is en block. Gon's method is en block. Letule is en mass. Here it is Gon's is en block. Organs are removed in functionally related to groups. Okay, so organs are removed in groups such as cervicothoracic, abdominal and urogenital blocks. Okay, here also it is block, en block. It is en mass is huge in Letule. Here Gon's, there is a small block, organs related. Okay, that is also important. And very high important thing is Rokitansky method. This is already asked and potential to ask again. Rokitansky method, if any infectious disease like HIV, hepatitis B, we have to go this autopsy method to minimize exposure risk. This is an in situ dissection, not ex situ, it's important. And organs are opened and examined directly inside the body before removal. So here minimizing exposure, especially like disease like HIV, hepatitis B, we are suspecting to that individual, we have to go for Rokitansky method. So these 4 methods are very important. Virchow method, most common method, and Letule is en mass, as a mass, and Gon's method, organ and related en block, and Rokitansky, HIV, hepatitis B, to minimize the exposure risk. And it is an in situ dissection. This is very important. This is also very important. Okay. Now we are going to some suspected cause of death where we can open first. Okay, for example, the suspected cause of death is something poisoning, we have to open the cranial cavity. Why? Because in poisoning, that smell can be get it from the cranial cavity. So in suspected poisoning, we have to open the cranial cavity, open first to detect any characteristic smell of poison. So in poisoning chapter mein, there are some smells, garlicky smell, okay, where it will come. So different smell is there. So pungent smell, different smell, ammonia fish smell. So this smell, if you open the cranial cavity, because this smell can be examined first from there. So in poisoning, we will open the cranial cavity. So in case of head injury also, we are opening the cranial cavity to see the cranial or brain trauma, EDH or SDH. Okay. So in this case, extradural hemorrhage and all, we have to see the hematoma and brain trauma should be examined from cranial cavity. In case of newborn, so abdomen is opened in newborn first. This is very important. In newborn, abdomen is opened first because this we can examine the diaphragm level. If the live bone, air will enter, diaphragm is at lower level due to lung expansion, but dead bone, diaphragm is at the higher level due to there is no air entry. So we can examine whether baby born live or not by newborn postmortem examination by opening abdomen first. Okay. In case of asphyxia, so cranial cavity is opened first. Okay. So here there is a sequence: cranial cavity, thorax, and abdomen, and neck is the last. Okay, neck is the last. Okay, so this is ensures a bloodless dissection at the neck structure. So this asphyxia usually happen here. Somebody put some and killing. This asphyxia happens here. There will be ligature mark will be here. So you are opening other parts. Okay, cranial cavity, thorax, abdomen. Last you are coming here. All the blood will be going and it will be bloodless, and we can examine the ligature mark and injuries. Okay, clear. That is asphyxia, cranial cavity. Pneumothorax or air embolism, definitely we have to see the thorax. Okay, so open first underwater to observe air bubbles escaping. So suspecting pneumothorax or air embolism, we have to open the thorax, immerse the lung in water. If air comes, there is air. Okay, like that we have to see. So this is also very important, and the potential question can be come from here is the newborn abdomen. Okay, and the poisoning, cranial cavity, smell. Okay, these all are potential questions, especially the newborn can come in the exam. Okay, clear. So next we are going to some other finding everyone have. Thumb impression, dactylography. So dactylography, fingerprinting. Okay, so this is very important. Most reliable method of identification is fingerprinting, punching. Okay, so here unique feature is fingerprints are different even for monozygotic. So this fingerprint which are different for even monozygotic identical twins. So for identical twins, many identification marks are similar, but fingerprints are different. Okay, so that is important. So development of this friction ridges, when this ridges development. So in intrauterine life, 12 to 16 week of intrauterine life it develop, and around 20 to 24 week it is completing. Imagine 12 to 16 week may this is developing, and 20 to 24 week may this is complete development. So that is from 20th week to 24 week only it is developed. Okay, so we can see the classification of this also. Earlier there are multiple questions. This is nowadays simple direct questions. So classification system is known as Galton system. So we have loop variety, whorls variety, arches variety, and composite variety. Okay, you can see arches here. See, so you can see arches here. Okay, you can see loops here. Okay, and you can see whorls here. See whorls. So this is whorls, this is loop, this is arches, like that. And composite is mixture. Okay, so there are different type examples are there. So that is also important just to see this. So dactylography, the development the intrauterine life. Nowadays it is coming like a theory question. Like there will be detailed explanation. They will ask starts development at 12 to 16, complete development 20 to 24, loop variety this, arch variety this. So you have to eliminate the wrong one. So sentence wise questions will come, not direct question. Now direct question you can identify it also. Okay, that also it is there. And one point in this dactylography, I'll add in identification chapter, one more topic will be added, small. So now this is the 5-star area. This is the 5-star area. Very important. Test for seminal and blood stain. So this is very important in identification, post-mortem identification or any unnatural death or rape or some problem, some event happened. So the police will come. They'll have some stains there. So they have to. In case if it is a rape, they have to check for seminal. If it is a murder, blood stain, some. So this seminal stain and blood stain examination is very important. In that, the repeatedly asked question is nothing but this only. Okay. So in seminal stain, we have two tests. One is the Florence test. Second one is the Barberio test. One is the Florence test. Second one is the Barberio. What is Florence test? So the result is a dark brown rhombic crystals. Here the choline iodide, semen contain choline iodide. So during this Florence test, we will get something called, so you can see here, dark brown rhombic crystal. This is dark brown is clear here. So these are the brown rhombic crystal. Okay, so you can see here, Florence test, dark brown rhombic crystals. So it will be like this only. You can see here, see, like this. See, like this Takeman cut test, similar only, brown dark. See, Florence test mein dark brown rhombic crystal because of choline iodide. This is very important. And next is Barberio. You know Barberio, ancient Greek character. He is going to kill his people, these enemies with spear, throwing this. So Barberio. So always think like this. Needle, yellow needle shaped. So something like needle, yellow needle shaped crystal. You can see here. Yellow needle shaped crystals. So yellow color needle shape. So yellow color needle shaped crystals will be there. Okay. So Barberio test, yellow needle crystals are there. So for seminal stains, we have fluorescence test and Barberio. Fluorescence, dark brown rhombic crystal because of choline iodide. And Barberio test, we have yellow needle. Barberio, he will use this spear. Okay, so needle, let it be small needle. So yellow needle shaped crystals will be there. Okay. Now we are coming to examine the blood stains. So blood stain we have Takeman test, Takayama test, and absorption spectrometry. The most specific and reliable method is the absorption spectrometry. What is Takeman test? So you can see here Takeman, which is similar to the dark brown rhombic crystals of the fluorescence. Here brown rhombic crystals will be there. So dark brown rhombic crystals because of hemine, because of hemine crystals. Okay. Takayama, you can see pink feathery crystals. So pink feathery because of pyridine hemochromogen crystals. So Takayama is pink feathery. You imagine Takayama is a Japan name. So they have some feathery dresses, feathery things. There will be feather will be there to do some dance and all. So Takayama is looking like a Japan name. They have some feather to dance. So Takayama, pink feathery crystals. And Takeman test similar to brown rhombic. So brown rhombic is common in, it can be seen in Florence and Takeman test. Okay, so we can understand like that. So we can differentiate the question. So seminal stain examination and blood stain examination. So this topic, which is very important, please put into your 20th notebook. Very important. Day before exam also see this. Okay. Now we are going to discuss some IPC section, which is also very important and potentially, especially medical MTP, medical termination of pregnancy enrolled. They asked multiple time, and we have to know some sections also. Okay. Now we'll see some sections from here. Okay. So section 191 and 193, 191 and 193 related to perjury. Okay. So giving false evidence. You are a doctor, you are giving some false evidence for something, or in some other person in a court case give false evidence. So definition of perjury is 191. Definition of perjury is 191. Okay, 191. And punishment is 193. Punishment is 193. Okay, important. This is very important. Now we have to see something like 269 and 270. 269 and 270. So 269 and 270 is very important. 269 IPC, negligent act resulting in the spread of a fatal infection. This is dangerous to life. And 270 is malignant act, same. For example, a person is HIV positive and he had done sex with another person, but he don't know he was HIV positive. So the spread was not a not like malignant, not like intentionally. So unintentionally it happened. Imagine one person know he is HIV or hepatitis B positive. He took some needle and prick him and prick the other person intentionally. This is a malignant act. Okay, so these are coming under 269 and 270 IPC. The negligent act 269, 270 is the malignant act, which is punishable. Okay, okay. So next one is IPC 299 IPC, definition of culpable homicide. You are doing homicide. 299 and 300, culpable homicide amounting to murder. You tried to kill a person and person died. 300. So 290 and 300. And 302 is punishment to murder. You kill, punishment to murder, 302. Okay. And 304A, punishment for a patient death due to medical negligence. This is very important for especially doctors like us. Okay. So 304A, punishment for patient death due to medical negligence, causing death by negligence. And 304B, punishment for dowry death. Dowry death, very very important. Dowry death. 304B, 304A due to medical negligence. So 304A for doctors who are doing some medical negligence and patient is dying. 304B is for doctors who are taking dowry and killing their wife. This has happened multiple times. It's happened. Especially I am from Kerala. There are many dowry deaths and it is happening everywhere. Okay, in India. Okay, that is very important. So from 299 to 304B. So 299 IPC, culpable homicide, and 300 amounting to murder, and 302 punishment to murder. This is very important. That series is important. 299, 300, 302. 304A, 304B, 304A is medical negligence and death of the patient. 304B is dowry death. We had given 500 grams of gold, 50 lakhs. They asked dowry given. Still they are beating and harassing the woman and killing. And the girl went for suicide, whatever. So this is like a system which has to be changed in our India. Because even we are educated, we are against dowry. There are so many people in front of us, they are taking dowry and the girls are literally suffering in their life. This dowry system should be banned. No one should take dowry. Okay. So people will come at me and your marriage photo means golds are there. See, that is dowry asking and harassing a girl or if their family is different. Okay. Investments are different. So it should be mutual understanding. My investment should be to her, her investment to me. Mutually we have to build something. Mutually we have to, so women who were housewife, we have to respect their job in their house. We have to value them. Imagine a house care worker is getting as paid like 30,000, 20,000, and a normal human man, he is going outside earning 20, 25,000. So he is hanging outside work. She is working the home. She is the base of the house. She is building the house. So never attack women. Okay, or especially these dowry things and all, we have to ban. We have to stop it. Okay, okay. This is very important. And next is another important topic. Okay, next is very very important topic. 312 IPC and 313 IPC. 312 IPC, punishment for criminal abortion with woman's consent. With woman's consent. This is with consent. It is very very important. And 313, punishment criminal without woman's consent. So 12 is with consent. 13 is without consent. So this is criminal abortion. Okay, this is very important. This can be the potential question here also. Okay, now we are going to the next. So 314, 312 we told, 313, 314, punishment for criminal abortion resulting into woman's death. So we have done some criminal abortion. The lady died. So 314 IPC. This is very very important area. Question will come. Sure. 312, 313. 314, very very important. Okay, so next is another session. 390, 320 and 323, that series. 319 is known as definition of hurt. 320 is definition of grievous hurt. So hurt is different, grievous hurt is different. Grievous hurt, something that causing severe injury to the person, for example like disability. So I attacked one person, he got some mild laceration, he was fine, that is hurt, not grievous hurt. But I attacked one person, his hearing ability lost or eyesight lost, that is grievous hurt. So the definition 320, hurt definition is 390, that is also very important. And 323, punishment for voluntarily causing hurt. If you are doing voluntarily causing some hurt, 323 is the punishment for that. And 324, punishment for causing hurt using dangerous weapons, knife and all. You are trying, so you are attacked with hand, 323. You attack with knife, 324. Okay. And 325 APC, punishment for voluntary causing grievous hurt. So 320 is grievous hurt, 320 is grievous hurt, 325 is the punishment for grievous hurt. That is also very important. Okay. 326 IPC, punishment for causing grievous hurt using dangerous weapons or means. So you assaulted a person, eyesight lost. So 320, 325. You come with some knife, 326. So assaulted here. Okay. So eyesight lost. So that is 326. This is very important area. Okay. And we have 326A and 326B also. 326A, 326B. 326A means punishment for acid attack, which is very, very important. We had seen movies, okay? Okay, comment the movie. I had seen in Malayalam, Hindi. So punishment for acid attack. Deepika Padukone, Parvati Thiruvoth in Malayalam. Okay, punishment for acid attack. Okay, and punishment for attempt to acid attack. So you done acid attack. The lady got burned. That guy is punished. He tried, but somehow she survived. She didn't get that injury. There, he is attempted for acid attack. That punishment is 326B. A is attack and cause problem. B is punishment for acid attack. Okay. Okay. So A here is not attack. B is attack. A is acid attack happened. Acid cause injury. So acid cause injury. B is acid attack is there, but she is safe. But the person who attempted the attack will get punishment. So 326 A and B is also important. Clear? Clear. These all sessions are very important. From this only 90% of the question will come for NEET PG exam. This is very important. This much section only we should know in detail, and there is some section related to rape also, it is there. So we'll see the rape and things that time we'll see. So this is very important. Okay. Okay. Now we'll go to the next topic. This is also very important, psychiatry and forensic medicine. So insanity related test and rule. So a person is insane. So that rules are different for that person. Clear? So what are they? The mnemonic is I can defend. I can defend. I, irresistible impulse test. C, Curran's rule. A, American law of institute test. N for Norton, McNaughton's rule, and D for Durham's rule. So we should know McNaughton's rule, Durham's rule, Curran's rule, like that. So I can defend. I, impulse test, irresistible impulse test. Curran's rule. A for American law of institute, some American law is there. N for McNaughton's rule, and D for Durham's rules. These are very important. So we will see what is each. Okay. So now we will see what is Curran's rule. So what is Curran's rule? So we will see what is Curran's rule. It is came in 1961. So what it is saying, an accused person will not be held criminally responsible if at the time of committing the act, he did not have the capacity to regulate his conduct to the requirement of law as a result of mental disease or defect. It is little confusing, but see the downward. So even if the individual knew that they were doing was wrong, so whatever they did wrong, he was knowing that, and they lacked the will or capacity to control, okay, at their actions due to mental illness. The person had some mental illness. He know even attacking this will cause injury to him, but at the time he is in mental illness state and he don't have the capacity to control his mind. So in that case, he is not punishable. Because self-control was impaired by mental disease defect, person cannot be held criminally liable. Okay, this is important. So the mental illness person, he is in mental illness state and he is not able to control his mind that time, but he attacked one person and the person got injury. He know that this attacking will cause some injury to the person. That is there, but he cannot control or command his mind. Okay, clear. That is Curran's rule. Now we can discuss what is McNaughton's rule. Okay, so McNaughton's rules are there, Durham's rules also. They won't ask in detail, but they will ask some lines and they will ask which is the rule. So they'll put Current's rule, McNaughton's and Durham's rules. So you should know all these three, because any question comes from there, you will score it. Okay, so McNaughton's rule: psychiatrists are reluctant to enter the witness box because of the anachronistic and unscientific McNaughton rules, which are based on a simplistic and incomplete definition of mental illness. So actually, this is like little incomplete and definition. So McNaughton insanity defense is called the right-wrong test. So this is all the willingness of insane person to see. Okay, so this is little confusing. We can see here. So McNaughton rule: dependent did not know right from wrong at the time of act based on English law, and right to wrong, this is known as right wrong test, knowledge test, or cognitive test. So dependent did not know right from wrong at time of act. Okay, that is McNaughton's rule. Now Durham's rule: act was a product of mental disease or defect, not used since 1972, known as product test. Okay, so this McNaughton rule, Durham rule, all these rules are is like whether it is acceptable or not acceptable is in question. So McNaughton's rule, what they are telling: dependent did not know right from wrong at the time of act. And Durham's rule: act was product of mental disease or defect. This act is because of the mental disease or defect. So whatever he did, it is because of mental disease or defect. That is Durham's rule. Okay, so Current's rule is very easy and understandable, and McNaughton's rule, you should know these lines, just read it, and Durham rules also. So I didn't go in detail of this, just for understanding the sentence will come, just identify the option, eliminate the other part, and you should know these tests. Okay, they will ask what are the tests for insanity. Some 3 options, 4 options will be the 5th option will be some other test, you have to eliminate it. Okay, this is also very important. Clear? Now we are going to the next topic. So now some spotters here. So you can see here something. Okay, so these are protons giving a peak here. This peak is known as Bragg's peak. Okay, Bragg's peaks. So Bragg's peaks. So this is also a spotter. They will ask what is this? This is Bragg's peak. Bragg's peaks, entire energy is deposited at a single point. You can see at this point the maximum energy is deposited. Otherwise, you can see usually energy will be distributed like here, but it is point. Okay, this is peak is known as Bragg's peak. Okay, seen in heavy charged particle like alpha particle and protons. Alpha particles and protons, Bragg's peaks, and so they will ask in which particle this Bragg's peak will appear. Alpha particles and protons, which are heavily charged, where all the energy is concentrated at a single point. That peak is known as Bragg's peak. Okay, clear? This image is important. Okay, this is important in radiology. Clear? Now we'll see some contraindications of MRI. So MRI, you know, magnetic resonance imaging, so this here magnetic energy will be there. Okay, so any metallic things contraindicated. So any person with some metallic, for example, a foreign body in the eye, which is a metal, if you do MRI, it will move, it will cause injury. So any foreign body in the eye, if you do MRI, it is contraindicated. Okay, so we will see. So this magnetic energy will be there. For example, if your MRI machine is there, you didn't cover it properly. If you are working with some metallic thing, it will cause some magnetic problem and attractions and problem to the person. So we have to cover the area. So something called that energy should be restricted and it shouldn't transmit. We have something called Faraday's cage, known as Faraday's cage, made up of copper wires. So wrapped around wooden panels. So wooden panels will be there. In that this copper will be wrapped multiple times. Okay, to prevent magnetic field from interacting with outside environment. So Faraday's cage is important. So what are the absolute contraindication of MRI? Cardiac pacemaker, cochlear implant, and metallic foreign body in the eye. Okay, and ferromagnetic CNS aneurysm clip. So the person went for aneurysm surgery, they put a clip which is a ferromagnetic material. So it is causing problem. Cardiac pacemaker and cochlear implant. So we cannot do. This is absolute contraindications. Now we'll go and see what are the relative contraindications. Claustrophobia, the person who are afraid of hidden closed room. So claustrophobia, phobia of closed space. Okay, so what is agoraphobia? So many people will develop exophobia zone. They will be developing anxious tension. I am not. I am steadied by. I am forgetting. Heart rate increase. They will go to hospital. So we had seen the patients also during final year exam. Students will come. They'll feel like sick. They'll come to us and they will motivate, counsel them, and they will send it back. So exam phobia is similar. Will be there. So claustrophobia is fear of closed spaces, and some devices like insulin pumps, nerve stimulator, epidural catheters, prosthetic heart valves. These are like relative contraindications. And first trimester pregnancy, loud noise while scanning may cause deafness to the developing fetus. This is also relative contraindications. Okay, clear. This is contraindications for MRI. Faraday's cage is very important. What are the absolute contraindications, which is very important? Okay. Now I had kept something in the law that is nothing but the barium studies. So barium can be given. Barium salvo is there. Barium meal can be given. It will go little more down. Barium meal follow through is there, down. And barium enema from enema will keep down. So these are very important. We should differentiate from. See, you can see the barium enema. You can see the bowels here, rectum and colon part of transverse colon, descending ascending colon. This is barium meal follow through. It went from duodenum to stomach to it went to it follow through. It went through, and you can see from there. You can see the bowels, small bowels and all. Barium swallow the esophagus. You can see the esophagus starting of stomach. So you can see some constriction here. And barium meal, it will be in the stomach. It's a meal, so it is in the stomach and duodenum parts and all it is. So this also very important part. You should know. You should differentiate barium swallow, barium meal follow through, and barium enema. This is also very important. Okay, now one more last topic which is very important, repeatedly asking, and people will do many times. They do mistake here. Even I did mistakes. So we have the phases of cell cycle. We have cell cycle, we have mitotic division, we have meiotic division. So cell cycle may we have phases. We have G1 phase, S phase, G2 phase, M phase. G1 is growth 1 phase. S is synthesis phase, G2 is growth 2 phase, and M phase is the mitosis phase. Okay, these phases will be there, where here mitosis cell division happen here. So preparation of cell division, we have to synthesize, replicate materials, cellular materials, growth phase, synthesis phase, all things will be there. So this phase have, so you can see G1 phase, S phase, there is the what we can say is the interface here, S phase and G2 phase interface, G2 phase, M phase. So whenever we will do radiotherapy, so we have to be careful. Okay, radiotherapy, maximum radio sensitivity at G2M junction. So at the G2M junction, radio sensitivity is high, or at M phase. After G2M के बाद it is M phase. So whenever you radiotherapy, this is the most important area, especially this is the area where it is highly sensitive, because this is going to divide. So if you give radiotherapy, it is sensitive, it will can cause some changes like mutations. So mutations or changes happen at this phase, G2M phase or the mitotic division phase. So G2M junction or M phase. So minimum radio sensitivity at the synthesis phase, where synthesis is happening. S phase is the minimum radio sensitivity. So this potential question can come, already came, it can come multiple time also. So we are discussed about the some spotters like cell cycle phases and importance of radio sensitivity, G2M more than M phase. This is important, less at S phase. So this barium ka things and MRI content and Faraday cage also very important. And Bragg's peak, this can come as again a question, alpha and protons, which is important. And this is some rules. Please, if you want, just to Google it. It is difficult. Magnotons and Dura and currents rules is easy. All are related to insanity. Okay. And this IPC section, how please stick on to your wall, study section wise. Okay, 312, 313 and 314 related to the abortion and hurt, grievous hurt and acid attack and everything, and perjury and all these homicide attempt and murder and everything is important, and dowry death is important, medical negligence is important. This is very important area, and this is also very important. Test for seminal stains and blood stains is very important, and dactylography also important. I will add something in the next coming days, and this autopsy also very important. So today whatever we discussed is very simple, but this is a very highly important question, can come definitely from this today's video, there will be 2 to 3 questions for your NEET PG exam. So day 4 is very, very important. We are expecting some 3 to 4 questions from this, or 3 questions sure. Okay, so please watch this at your free time. Please watching some 720p higher quality and make notes. I'll be sending notes even after say one day. In the previous third video I had put the link of my WhatsApp channel. I don't want many people to come, that's why I'm not putting here. So please watch it and please subscribe. Tomorrow I'll come with a little more interesting topic. Thank you.